Great. Okay, so I'm going to start today's conference by welcoming you all to Rosa's 2025 Summer Conference. This is the largest annual conference in the women and girls sector, and we are delighted that over 750 people have signed up to this year's event. I'm Rebecca Gill, and I'm the CEO of Rosa. Rosa is the UK's only UK-wide funder dedicated to funding and strengthening the women and girls sector, recognising the critical role women's and girls' organisations play in addressing the misogyny and sexism, as well as racism, poverty and male violence that is so prevalent in our society. But our sector is underfunded and it is overstretched. Rosa's research shows that just 1.8% of all charitable grants are awarded to women-led women's and girls organisations. Our most recent research shows that 90% of our sector has experienced an increase in demand for their work in the last year. That is compared to 65% of the charity sector overall. But on top of that, over 60% of our sector has experienced either no change or a deterioration in funding, with over half of the organisations we surveyed saying that funding is their number one concern. So what we're seeing is a sector where demand is rising and funding is either flatlining or it is dropping. At Rosa, we know that this situation is unsustainable and frankly, it is unacceptable. It is threatening the survival of organisations. It is limiting the capacity of our sector to change the systems which harm women and girls. And it is preventing us from building a society in which women and girls can be safe, healthy and equal. And that's why today's conference is so important. We want it to be an opportunity to come together, for you to connect with others in our sector, to share your concerns and celebrate the work that we do and the change that we make. Across 2 days, we'll hear from organisations and individuals sharing their insights about the work that they do and the change that they make. Some sessions will be in webinar format like this one, where you can see me, but I can't see you. And some will be in meetings where you can see other attendees and join discussions and breakouts. We have created the conference so you can hear from others, but also so that you can contribute. And there are short feedback surveys for you after each session. And there's a megaphone in the lobby, in the top right of the lobby, that you can click, and we really want you to tell us what you think. Today's sessions will be recorded, and you'll be able to catch up here in the event lobby for up to 1 month afterwards. Shortly, we'll be opening our first panel, which will be focusing on the value of the sector as a whole in driving social change. After that, at 11:30, we will hear from organisations from across the UK who will share insights from their work. And at 1:30, you can connect with others in the sector through our online networking sessions. And at 3 o'clock, there's a chance for you to meet with funders investing in our sector. This year's conference, unlike some previous years, is actually spread over 2 days. And tomorrow is all about strengthening the sector through training. So we'll be offering free training sessions. You don't have to book them. They're not recorded and they're very interactive. And all of them are delivered by women connected to our sector. I do hope you can make the most of the next 2 days and get from it what you need. And I hope that you can leave our conference with a real sense of hope and possibility that our sector creates. I want to also thank one of Rosa's really important funders, Cummins. who are a company through their Cummins Powers Women programme, is a funder of Rosa and is a big supporter of our conference and of our Voices programme. And I know that some Cummins staff will be joining us today, and that's brilliant to have them in participating. So I'm now delighted to be handing over to BBC presenter and news correspondent Frankie McCamley, who is chairing our first session. Welcome to Frankie.
Thank you, Rebecca. Hello, everyone, and thank you for having me. Thank you for joining the session. Just to introduce myself first, I am, as Rebecca said, I'm a BBC journalist and presenter, and I have a big focus on violence against women and girls around the world. And sadly, as you can all see, it is in the headlines still every single day. And I met Rosa and the team when I was covering the Sarah Everard case and looked at where the money that was raised following her death was distributed. And that gave me a real insight into so many people, women in this sector, doing incredible things to tackle violence against women. And I'm pleased to say that some of those people will be joining me for this panel now. And we're going to hear a lot more about the work they're doing in the sector and the fantastic changes they are making. So first of all, Khudeja, who is the CEO of Shama's Women's Centre in Leicester, which runs programmes to build women's confidence, help them get jobs, as well as with health issues. Khudeja is a very busy lady. She's pioneered an innovative mental health programme, which goes on to help with education, work, health inequalities. Khudeja also advocates for patients on various boards within the NHS. So welcome to Khudeja.
Yes, it's great to be here today, and thank you for that fantastic introduction. I mean, women's and girls are our bread and butter. We're their voice, and we do everything to support them along their journey of life. And it's really great to be here today and to be part of today's conference and share what we've done and celebrate it.
Well, thank you for your time, Khudeja. We really appreciate it because we know how busy you are. Okay, next up, Abbi, who is Director of Strategic Development of the National Women's Justice Coalition, which brings together women's organisations. So they work on a slightly different level to try and drive change and improve outcomes for women and girls who are in contact with the criminal justice system. And Abbi, you're not new to this. You've worked in the sector with some of the most vulnerable women in society for over 15 years now.
Thanks, Frankie. Yeah, lovely to join you all today. It's a privilege to be part of this conference, and I'm very delighted to be representing the National Women's Justice Coalition, which, as you've said, is a collective of multiple women's organisations working with women at the sharpest end of disadvantage. So, really pleased to be part of these conversations to hopefully identify what we need to do to improve outcomes for women and girls.
Great, and I'm sure we'll hear much more about what you're doing in a moment. And last but not least, Rebecca, who you've already met briefly, the CEO of Rosa Fund, who is hosting the conference today. Now, Rebecca has over 25 years experience working to improve the rights of women and girls in the UK, including working with the Young Women's Trust, the TUC, the Fawcett Society, and the Government Equalities Office. So again, another very busy lady, Rebecca.
Yeah, thank you very much, Frankie, and I'm really looking forward to talking about the change that the sector makes in today's session.
Great. Okay. Well, as you can see, just from those introductions, we've got a lot of insight and expertise right here in the room today. So we're going to have a chat with each panelist, and then hopefully afterwards, if we do have time, I can't promise this, we may be able to take some questions. So do pop any questions you have in the comments box. First of all, let's head over to you, Khudeja. You are a small and specialist organisation. You've got a real focus on a particular group of women, but how does an organisation like yours deliver change?
I think the most important thing for an organisation like us, and we deal with predominantly women who are vulnerable, Black, Asian, minority ethnic women in particular, because we're based in some of the most deprived areas of Leicester. We've been around for 39 years. But the key to our success and impact is listening, our service users, the women that we speak to, and the girl, is about listening to their issues and their challenges and providing services that actually meet those particular challenges they have. So, for example, I joined, though Shama's been around for 39 years, I joined back in 2012, and I remember hearing some horrific stories of women who'd come from abroad or and seen were absolutely distraught because they'd seen their families burnt alive, they'd seen horrendous things happen in front of them, and they needed proper mental health support, or they'd lost a child at birth. So if you imagine, a lot of these women were like third generation who settled in Leicester, and back home in those communities, it was a common thing, high mortality rates. But these women had lost children at birth or during pregnancy, and they were expected to carry on. And I can remember my mother saying that my mother lost 3 children under the age of 4 back home, and she said we just carried on in the field. So there was that expectation. So using that information, asking, I actually conducted research for 474 bereaved women from ethnic minorities communities, and said, what would you like? What would have helped you? And we developed a service around their needs, and that was bereavement counselling, and it was called Bereavement to Achievement. We offered practical English skills because language is a key barrier. We developed peer support, befriending, so a whole range of services, and that's how our organisation has developed. But the key things in terms of impact, we were never funded by the NHS, and that's only recently, in the past couple of years, they realised what value we can add. We as an organisation, I've been a spokesperson for that service and informed the delivery of their mental health services, and it's grown and grown. So we've had a huge impact. I've spoken at the NHS national conferences, sharing good practice, and also in regional meetings as well, sharing good practice, and we've developed programs meeting those gaps and encourage change. And one of the things, for example, we're talking about hospitals again, is imagine yourself as going into hospital as a patient at a time of trauma, how nervous and anxious you'd be, but not being able to speak the language, not being able to say I'm in pain or talk about your medication. So we developed our own programme, ESOL, Your Stay in Hospital, working with our local trust, working with the Integrated Care Board, getting together what they needed and what we saw our women in the community needed, and developed a programme to actually address that. And we've informed things like, women wouldn't take up go for their scans, and you've heard about this horrific stories about women losing their babies, mortality rates in those communities. So we encouraged women. I developed programs with the local trust to ensure women would actually take up their scan, because it's often a mixed male sonographer. So I think the key thing is that we've been that voice for those women, but being on platforms to raise what we've done. I think too often as organisations we're busy to day-to-day running. I keep talking about my revolving door in my office because people just come in and out when I'm there. And I tried to work from home one day, where I am today. But the fact is you're wearing many hats, and it's just really trying to step back and promote what you're doing. We're not good at shouting about what we've achieved, and it's only when you sit back and think, gosh, we've had a huge impact on people's lives, we've saved lives. And every day, and I think some days you feel like, why am I doing this? And I think I'm here to save lives, I'm here to improve the quality of lives of women, I'm here to be a voice for those who haven't got a voice. And that's the key thing. We have influenced enormous change, and I speak on national lay boards for NHS, raising the voice of women and those communities that aren't heard. And I think we can do it. It's just making time and making sure that we are in places where we're going to have a huge impact.
That's absolutely incredible. Thank you, Khudeja. A real insight to what you do on so many different levels. So it's not just about helping individual women, but it's that overall arching kind of research into what's happening and then actually implementing change. Abbi, on to you. Talk us through what your coalition does. It's on a slightly different level to Khudeja, but how does your coalition make individual women's lives better?
Thanks, Frankie. Well, I mean, Shama Women's Centre is a member of our coalition, the National Women's Justice Coalition, and we are a collective of 26 women's organisations that have a criminal justice focus. So many of our partners deliver the Women's Centre model or specialist women's services to women in contact with or at risk of having contact with the criminal justice system. And coalitions like the National Women's Justice Coalition are a really important part of the ecosystem of the women's sector because they help to facilitate and enhance partnership working. So organisations can come together, work more collectively, amplify their messages, their campaigning efforts and their influencing strategies to really affect change that directly benefits women and girls. Oftentimes coalitions are formed because the organisations involved share common values, strategic objectives and aims, and that unites them in collective action. And often that action is driven by the systemic change they need to see. And that's change in the case of an NWJC is to look at how we can improve outcomes for justice-involved women and girls, how we can avoid the stigmatisation and criminalisation that women are often subjected to through their contact with the criminal justice system, and how we can address the complex needs that these women and girls have to improve their long-term prosperity and outcome. So together as a collective group, organisations can coordinate their influencing efforts, and we can begin to affect government policy, statutory funding, public messaging, campaigning, and we can work collectively to be consulted on key legislation and systemic change that needs to happen to improve these outcomes. One example might be from the NWJC's perspective is that we have been calling for the formation of a Women's Justice Board early on this year as we were preparing for a change of power in government, recognising that the female offender strategy had not been realised and the recommendations of the Corsten report had not been fully embedded in justice policy. So very early on this year, we as a collective began to shout loudly about the fact that you needed a Women's Justice Board to really focus on these issues. So we were delighted when in September, the Secretary for Justice announced the formation of a Women's Justice Board that's been chaired by the Prisons Minister, Lord Timpson, and is now very much focused on reducing the number of women in prison and making better use of community sentences and support for those women. So again, that is directly impacting outcomes for young women and girls. And also coalitions have the power to amplify the work that organisations like Shama are doing. And as Khudeja so eloquently explained, the level of specialism and expertise that is happening at a local grassroots level in Leicester, but within other organisations that are delivering services across the UK and that are members of our coalition and many other alliances. You know, we can really shout loudly about what those organisations are doing and achieving and the impact that they're having. And by demonstrating the value of those specialist services, we can help to strengthen the case for the funding and investment in those organisations. It's really important to safeguard the future of small specialist grassroots women's organisations and recognise the value of gender responsive care that they deliver. And as Khudeja's explained, you know, the frontline demands of delivering services and managing organisations and being involved in everything at a local level can sometimes mean that organisations don't have the capacity to feed in at national level. So a national coalition like the NWJC or many other alliances can really act as a big sister to our little sister partners and help to safeguard their future through demonstrating their impact, inviting and profiling greater attention on the impact of the work that they're doing. And you know, more investment in women's organisations means more women's centres, more women's specialist services, and ultimately that is benefiting individual women and improving their lives.
So many different topics you touched on there, Abbi, and we've got lots to get through. So we'll go back to some of those topics too. I know we're seeing some comments in the chat at the moment, but on to you, Rebecca. So let's talk about the role of the funder now. As the funder supporting, advocating women's rights. How do you fit into the sector?
So as I said in my kind of intro, we are the only funder that's dedicated to investing in the women and girls sector. And we do this because, as Khudeja and Abbi have so brilliantly illustrated, women's organisations throughout history and today are critical for addressing those very, very deep-rooted issues that so many women face. So poverty, inequality, racism, male violence, the criminal justice system. And at Rosa, we often talk about an ecosystem that we want to fund women's organisations in all parts of that ecosystem, the very, very small micro organisations and the much larger organisations, those that are delivering frontline support, as well as those that are doing that kind of influencing and lobbying work, and those organisations that are doing all of it all the time. And I think that what Abbi and Khudeja have talked about is such a good example of that. And I think at the moment, I mean, we're worried about a bit about the funding sector, because we're worried about seeing a bit of a deprioritisation of women and girls' work. And sometimes we get a message from funders that they don't think that the women's sector delivers that sort of systems change that they all want to fund. And for us at Rosa, that's a kind of fundamental misunderstanding of the power and importance of the women and girls sector. And I think, as Khudeja said, you start very small with women's lived experiences, and you sort of build up, and you're able to then build the case, and then you come together in a collective, and you do the kind of work that Abbi's organisation does, and we see that across the sector. And I'm often reminded, I've got a little post-it note here. There's a quote by Desmond Tutu, and it's really, it's a good quote, and I often think about it. But he said, "There comes a point when we need to stop pulling people out of the river. We need to go upstream and find out why they are falling in." And I think it's a very laudable aim. But I worry that what happens in funders' minds and some charities' minds is that they're always saying, well, what we need to do is work out why people fall in the stream. And it's quite a neat thing. People fall in the stream at the top, and then we, in theory, pluck them out at the bottom. But what we see in the women and girls sector is that the stream is not neat, that women fall in and out of it at all points, and that the women and girls sector actually operates all the way up that stream. And that's what we want to fund, because that's how you create systems change. That's how those organisations deliver that systems change. And that's what we're trying to do at Rosa, is to fund organisations throughout that process, because we know that women's lives are not linear, girls' lives are not linear, and therefore how we fund is not going to be linear either. And we'd very much like to see other funders come on board.
Absolutely. I mean, Rebecca, that metaphor that you just gave there, it really does visualize it, doesn't it? And it really kind of explains what organizations like you are trying to do. And we've spoken in the past about how it takes a woman to die or a woman to be seriously injured for funding then to come in, and then it drops off a cliff. Obviously, we'll speak more about that. But what I want to move on to now is the relationships with one another and how you all work together. And firstly, to you, Khudeja, what are the benefits for an organisation like yours of collaborating with others, and how does that work?
Okay, I think the first point is really important. No one organisation can solve the issues that we deal with in the women's and girls sector. The poverty, cost of living crisis, domestic abuse, mental health, health inequalities. We deal with all those issues, but we're dealing with them on a day-to-day basis. We don't have that clout nationally, and we need a platform like those statutory partners, like those coalitions nationally, to able to voice to actually put them in reality, take them from their ivory towers and say, this is what's happening, in reality. I remember speaking at one of the conferences at the NHS, and I said, there's communities out there that don't trust the NHS, and there was absolute shock horror. They couldn't understand why. After COVID-19, there was, if you look at the high proportion of Black, Asian, minority ethnic communities, that mortality rates were very high. So it's ensuring that you can get into those organisations. And I want to share one example with you. We, as a small organisation, we attracted some funding for raising health inequalities, a core 20+ programme, and that looked at the disengaged groups with high high rates of mortality rates and low uptakes of kind of cancer and hypertension and heart conditions. And we recruited a whole load of lived experience ambassadors, women, and particularly for the cancer side, for raising awareness, for taking up smears, which we know is, and one of our ambassadors, she did some research with the ladies, and one of the key obstacles deterrent for women to having their cervical smear test was the dignity element of having to take the underwear off. And so she designed a pair of pants, popper pants, and she tried lots of different things, but poppers worked. And she gave them to a local GP to try, and our local trust. And we as an organisation, because she was one of our ambassadors, she was also a sewing tutor at our organisation, we promoted that nationally at the conferences and regionally, and I think the fact a simple solution, and often it's such a simple thing, you know, and you don't need reams and reams of meetings and meetings and meetings. Just get on with it and do it. And that's what we do. But we were able to latch on to our local ICB, to our trust, to nationally, I suppose, in terms of health inequalities on various boards there, and everyone thought, what a marvelous idea, you know, why didn't we think of it before? And that's been rolled out nationally. So that, and I think for Talent, who actually created, I mean, she's the one who created, I would never be able to do anything like that. We work together, and it's almost a little piece of a jigsaw to influence a bigger change. And for her, I think she was able to save the life of a friend who went for a smear, because of the pants, to try them out, and she was diagnosed with cancer, but it was treated had it not been for that. So, you know, you start small, you grow, you have to be in those platforms where you can promote the work you're doing. And locally, we're part of the VCSC Alliance for Health, and that's got over 300 organisations, small organisations and charities like ours, who specialise in particular areas, so we can raise our profile in terms of the work we're doing. And it's also a network. I mean, working with the National Coalition, with Abbi, it's not our specialist areas in terms of dealing with women in the criminal justice system, but it's an area that I feel very passionate about. We should be helping every single woman, and particularly in the communities I deal with, that they're very stigmatised and tarnished if you've had a prison record. But if you look at the reasons why these women have gone into prison, into the system, it's often because they couldn't feed their children. You know, it's often because they were victims of abuse. We deal with hundreds and hundreds of victims of abuse a year, and it's finding out the reasons. But once they've gone in there, you know, how do they get, you know, and those children are taken away from them. So, you know, again, we provide that through Abbi. She was able to get us in touch with funders, and also through the network, actually partners to support me in our journey in terms of how do we financially be able to deal with women from the criminal justice system. So it's having that network, having someone to go to support you, because, you know, it's very difficult knowing who to go to, and it's very, very reassuring to have organisations out there that can support us to do the many, many things that still need to be done and will always need to be done because of the growth, because of the crisis that's out there facing women and girls. And something I'd like to say, I was at a conference, and the one of the key talkers at that conference, and it was talked about, it was actually a funder said they're now going to fund international countries because women out there that don't have kind of sanitary towels. But we have the same issue here in Leicester. There's women there that can't afford sanitary towels, can't afford sanitary. So we actually work with organisations that can do that. So, you know, these problems are rooted here deep in this country. But it's, again, using the platform of those large organisations and the support, peer support you get through that in order to do the work that you're passionate about.
Really, really wonderful, and really, really nice example there too, to understand how those grassroots organisations can then pick up on something so small and then use other organisations to amplify that and make real international change. Thank you, Khudeja. On to you, Abbi. So talking about Khudeja working with you, but then on the other hand, how can, for you, Abbi, working with Khudeja help your coalition, and how do you support them?
Well, I mean, our partners are our lifeline, our bloodline. We need to understand exactly what those organisations are doing on the front line, the challenges and issues that they're trying to combat, and the issues that women themselves are presenting with, because it's all of that intel and expert insight that we use to then shape our campaigning, our influencing, our messaging efforts. So an organisation like Shama, that's delivering very specialist, culturally responsive services in Leicester, has a very particular experience of delivering that service in that part of the country, will have very particular challenges in relation to the local funding landscape, the relationships with the local authorities, other statutory providers, etc. And all of that is, very important information for us to gather at a national level, because it helps us to
Abbi,
really
can you just pull the mic a bit closer to that's right? Yeah.
Sorry, apologies. So yeah, we really need that local expertise and insight to inform what we do in terms of our asks, our influencing efforts, our campaigning strategies. And without that, those eyes on the ground, we don't have really an evidence base and the data that we need to substantiate what we're asking. So that really forms the basis of our strategic direction, what our partners tell us they need, what the issues that they're dealing with look like, and what their asks are, because in turn that influences what we collectively need to advocate for. And a coalition like the NWJC is operating with a feminist leadership governance structure. So every partner is equal and just as important as the next. So although we have some very small specialist partners, we also have some larger, more national providers, and those organisations are working together to support the work that's happening on a national level. So there's a pooling of expertise, there's a sharing of intelligence, there's the opportunity for organisations to maybe develop partnerships or collaborate on funding opportunities. And so that's really how we try to support our partners. We try to give them opportunities that they may not otherwise have at a national level. But we also need to work collectively to drive the systemic change that we're talking about today. What is it that we want to achieve? And a really good recent example of that would be when the Sentencing Council called evidence to inform the sentencing reforms that they were going to recommend. We were able to collaborate with all 26 of our partners to discern what is the issue for your women, for your girls. What is it that those women need to see through their contact with the criminal justice system? What changes will benefit them? What information do we need to feed back to something like a national consultation and call for evidence that will ultimately go on to inform justice policy? And so together with our partners, we were able to cultivate a very clear set of recommendations that we put forward to the Sentencing Council review panel, and that we feel have been well reflected in the subsequent recommendations that have come through that piece of work. So as an organisation that is delivering, for example, a very small specialist service in part of the country, that has an understanding of what the issues in that geographical space look like, what women's experiences of probation services in that part of the world are, what women's experiences of coming out of prison might look like, what are the barriers to women getting the support they need. All of that intelligence helps us to develop a national picture, and that in turn informs what we say we need to happen, the change that we need to see. So I think, to speak to the question, Shama and our partners are really critical to informing the direction of travel that our coalition takes. What are our strategic objectives? Well, we need to consult with our partners. We need to understand what the priorities are with this shared set of values and shared mission statement that we all have come together because of. And then in turn, we want to amplify and demonstrate the value and impact of their work to substantiate all of our arguments for better investment, better funding, long-term sustainability of these services, because we know the value and the impact that they're having. And if we can demonstrate that at a national level, it will go on to hopefully help to safeguard their future as well. So it's a real, we benefit hugely from our partners, and we hope that our partners benefit hugely from the work that we do as a collective.
And it just shows how important a collective like you is to bring all of those different opinions from across the country. Like you said, someone's justice system in one area of the country can be incredibly different to another woman's, say, in Scotland. So really important to bring different opinions together and then have that voice, and that really strong voice. Now, you mentioned funding really briefly there. Let's go on to that now, and I'd like to come to you, Rebecca. Rosa has done some research into the funding sector in the women and girls sector. Can you just talk us through that? You mentioned it briefly at the start of this panel, but can you just talk us through your findings?
Yeah, and actually just to say that one of the reasons why we do the research is not only to sort of champion the sector to the funders, but also we really urge women's and girls organisations to use the research to support their own cases for support. So we really want it to be used in many. We design it with many different purposes in that regard, and we published research which mapped the funding into the women and girls sector, and we did this in partnership with the National Lottery Community Fund and Esme Fairbairn Foundation. And it was really designed to, we were getting information from funders saying it's absolutely fine, we're funding the women and girls sector. And we were getting information from women's and girls organisations saying, well, we're not getting any of that money. So where is this hole in which the money is falling into? So we set out to map where the money was going. We worked with Sheffield Hallam University, and that was a really important piece of research. We think it was probably one of the first of its kind, really. And it showed that, as I've said before, that just 1.8% of charitable grants were going to women-led women's and girls organisations, and that an additional it was around sort of £70 million was going to gender-neutral organisations that were offering women's delivering some women's services. There's nothing wrong with those organisations doing that work, but for Rosa there's such an important piece about funding the sector, because I think, as Khudeja and Abbi have both described, there is something about organisations that are led by the women who know what they are doing and who will deliver in the best interests of the women that they're working with and on behalf of. And so our research was, critically important, and we know that lots of women's organisations have used that to build their own case for support. More recently, so we published that in 2023, but more recently we've done a survey of the women and girls sector, and that's where we found those, the stats that I quoted previously. About 90% of organisations are expecting an increase in demand, have experienced an increase in demand, and that 52% have funding as their number one concern. But within that, and we continue to be really concerned about that kind of underfunding of the sector. But actually, and I've kind of got the reports to hand, but there are specific organisations that really, really suffer. They're often very small organisations. Black organisations led by and for Black and racially minoritized women and girls do particularly badly around funding, and 97% of Black-led organisations have experienced an increase in demand, and all of them are expecting that demand to increase in the next year. And they're much more likely to be smaller organisations as well, and to be small and stay small. And our concern at Rosa is that funders look at smaller organisations and they say, well, you're not ready to take our money. And so organisations then can't grow. And that's why we run our RISE fund, and it's open at the moment, and it's specifically for organisations led by and for Black and minoritized women and girls, so that they can access funding to support their own growth. And what we know is that what organisations want is that organisational development funding, and that's what we really, really try to prioritise at Rosa. We're also concerned, and our research has sort of backs it up, about the lack of kind of funding for girls organisations. So what we're concerned about is a drop of funding for the women and girls sector, and a drop of funding in the youth sector puts girls organisations in the middle of a very kind of dangerous Venn diagram where they're losing funding from both sides. And we know again that girls' organisations often really struggle to raise that kind of money. So we are often looking to, you know, to develop research. We don't want to waste people's time with it, but we do want to build the case for why the women and girls sector and where the real sort of challenges are for the sector, so that funders know where to come in and where to put their money. Because you know, as I've sort of said before, the work of Khudeja's organisation, the work of Abbi's organisations, the work of the women and girls sector is supporting women throughout their lives. And if the women and girls sector can't sustain itself, and if it's always in survival mode, it cannot deliver the work that we all need it to deliver. That is that kind of life-saving and life-changing work.
Thank you, Rebecca. And just to add to that, I mean, I've seen it, and I've seen organisations close down every single day that are helping women and girls. We see that, sadly. Okay, well, Khudeja, Rebecca mentioned there different ethnicities and especially minorities who are really struggling in this sector. What's the funding situation like for you right now?
Well, funding's always been a challenge, always. The problem with funding is it's very short term. And if you want to invest in the sector as an organisation, you need something a bit long term. No matter what, it's very project based, the funding. Majority of our funding is grant funding. That shouldn't be the case. We want to move away from that model. We want a more sustained model. We're using traded income. But again, it's having that expertise on board and recruiting people who are able to take your organisation in that particular area. We had funding from Rosa, and it's been amazing. Thank you, Rosa, for that funding that helped invest in the skills of our staff and our volunteers to do some of that work. But when then you go out, but the problem is it's about retaining staff because funding is so short term. We develop them, we get them to a point, then we cannot compete with the statutory organisations, other organisations out there who have lots of funding, who we can afford those rates because we have to also, for example, we as an organisation lease our building and it's paying the rent and all the other running costs. But often with funding, that's not taken into account whatsoever. You know, it's just looking at the project delivery costs. So as an organisation, how do you maintain a building? How do you, support your staff training and development? So I think that's a huge issue. If we are to grow as a sector, we need to invest in our staff. We need to have funding that's sustainable and to be able to retain those staff, and all the experience, all the tacit knowledge that comes with that. And it's very difficult. It's very difficult. We're just kind of working up very, very stringent measures, but we have to survive. We've survived 39 years of cuts. We're the only organisation that offers conducive culturally support services, the range in Leicester that survived. And after lose sleep thinking, my goodness, what would happen to these women if we weren't here? What would happen to those families? We've had 439 women and families say stay in the last year alone, and that's on 1.5 worker. We can't compete with the large organisations, but we offer that specialist and they support and they come to us. So I think funding is really, really crucial in terms of making sure it's sustained funding, so we can develop and retain those staff, because otherwise you're just going to be losing the expertise that you have. So that's always a struggle. Yeah.
So that core funding, that is what you need, for sustainable funding, not when it's just in the headlines. You need something that will last, and you can build people up and make sure that they are the right people for the job. Well, Abbi, listening to all of this, and you have this broader knowledge of the sector, and you speak to so many different charities. What would you like commissioners and funders to know?
Well, I mean, I want funders to understand that women's organisations are facing a cliff edge of funding. It's as dire as it's ever been, and without sustainable funding, we are going to see the cessation of services. We're going to see reduced caseloads, and organisations are going to have to shut, which is absolutely unacceptable. I mean, some of the challenges that Khudeja and Rebecca referred to are also really important for commissioners and funders to recognise. If we look at the cost of living increase and the operational costs that organisations are now having to foot, in addition to delivering their services, the running costs of centres and women's organisational spaces, the employer national the national insurance contributions that employers are now having to cover. Again, those have increased. The true cost of delivering services is very rarely reflected in funding. And that has to be addressed as a priority, because organisations cannot just be funded for short periods of time for innovative work. We know what works. We know that certain services have to be sustainable in order to be impactful. As Khudeja is saying, we need to ensure that staff teams can be assured of their role and know that their contracts are not short term or subject to funding being renewed. All of those challenges, operational challenges that organisations are facing, has a massive amount of stress, but it's a huge financial pressure on those organisations to keep their doors open. And I know so many amazing organisations that are covering their costs with their reserve funds or finding ways to make ends meet that are so admirable, given the stress and pressure that they're under, that funders need to recognise how dire the situation is for partners. Within the coalition, within the National Women's Justice Coalition, we did a survey of our 26 partners earlier this year. And we found doing that survey that 77% of our members had not secured sufficient funding to cover their forecasted expenditure in 25-26, which is a terrifying statistic. Looking at the average increase that an organisation is going to have to invest in covering national insurance contribution or just pay their electricity and their lighting bills, those are hugely problematic challenges for women's organisations. And then the small specialist organisations that we've been talking about that are so critical to the sector and to improving outcomes for women and girls don't have the opportunities to bid for large commission, they can't enter into public procurement processes or put in fancy all sparkling bids when there are more generic providers that have capacity to do that. Our small specialist partners are desperately trying to make ends meet with the funding that they have the capacity to apply for. And then when you have multiple funding routes, when you've got revenue coming in from different directions and you're having to report to one funder and you're having to feed back to a commissioner, the administrative pressure on a small specialist organisation to meet the contractual demands of being funded is also a huge constraint. So funders need to understand that not only is the landscape hugely worrying at this point, but commissioning structures, processes for accessing funding, they need to be more equitable, they need to be more accessible, and they need to be longer term. So organisations are not continually required to put in bids to sacrifice, their frontline work to enable them to just fill the gaps in their funding. And that situation, the situation that we're in is really unacceptable, as Rebecca said. We're undervaluing the social value that women's organisations contribute, as well as the actual impact that they have. And for an organisation to risk being closed, to risk having to stop its services, that is incredibly worrying, and funders need to understand that, not hang women's organisations out to dry, and actually really commit to this investment over a long-term period, recognising the specialty that women's organisations bring to the sector.
Abbi, thank you. An incredibly strong message there. Well, we do actually, for a change, have some time for some questions, which is absolutely fantastic because we've had so many coming in from you. So thank you for putting all of those on the Q&A section. We have a question for you, Khudeja, from Sarah Hutchinson, who says, we deliver a very similar programme to you in Thanet, which is also an area of high deprivation. We're a frontline ESOL and wellbeing project, but we're also developing our lived experience ambassadors programme and have begun to build coalitions locally. Can you give some insight into how this work was funded? We find ourselves stuck as we don't have women in leadership positions in the organisation, but we're on a journey to achieve this, but need funding to do so. This might also be a question comment from you too, Rebecca, if possible.
I think the key thing when we've recruited ambassadors, they've often been linked to a project, an area of work, for example, health inequality. So we've had a certain amount of funding, or workers' rights. We've recruited ambassadors. The key thing is to get people that have got passion and want to make a difference. And you'll find many of these individuals will want to give up their time because they've been affected, or the family members have been affected by those issues. So the magic ingredient is that passion and commitment. If you can get that, that will help. But also in terms of developing what we did, we developed a training program ourselves, because what I wanted to make sure is that when these ambassadors went out there in the communities, particularly on the health inequalities, to ensure that they all understood what the issues were, what the terminologies were, so they all, were speaking on a similar from a similar front. So it's getting those people and developing those skills, doing a skills audit, and trying to latch on to what funding is out there on those various projects that you're looking to support.
Okay, thank you, Khudeja. Sarah, I hope that helped you. I would like to move on to another question for you, Rebecca, if that's okay. It's from Joe Goff, who says, exceptional work from Rosa Fund on funding for women and girls. Having looked at the local data for Brighton and Hove, I think it may even have overestimated the funding, as some subcontractors went to non-women's organisations, as well as some LGBT organisations that are non-women led. They go on to say, be good to build on this research and look at current data.
Yeah, I think it's a really, really important question, and a few other people have mentioned it in the chat, and it's the way in which the public sector commissioning process works, and some other funding systems work as well, where the person with the money goes to something that looks ideal and large, and that is often gender neutral, and then they go to smaller organizations and women's organizations, and they say, can you deliver this section of it? And women's organizations lose out from being that primary deliverer, and the funder feels, well, they funded the sector, particularly in that kind of commissioning process. They think, well, it's fine, we're funding women's services, but they're not funding those services that actually women and girls want and need, that are led by women and for women and girls. And we are seeing that across the country, and it's certainly something that we're looking at how we can research more deeply. It's quite a complex piece of research for us, but it's certainly something that we really hear it over and over again from the women's sector. And I'd say as well that for what we know is for Black and racially minoritized led organisations, they're often given the even more complex but low paid contracts to deliver that work, and it's very, very complex, and they simply don't get paid enough to do it.
Okay, thank you, Rebecca. Another one to Abbi and Khudeja. What makes relationships between different types of organisations like yours work well, and what, I think importantly, are the challenges too?
Well, can I start there?
Yeah.
I think what makes them work for me, and I think when I first came on board with the National Women's Justice Coalition, was, have I got the time for this? And and the key thing is for that coalition to be understanding and mindful of the time constraints CEOs have in terms of contributing. And it's been fantastic. Abbi, she made that quite clear. I don't expect to be at the meetings. And I think it's that understanding of what's really happening on the ground. So I actually had this feeling of guilt, because I thought I'm not attended, a meeting for so many months or whatever. But I think it's that reassurance, knowing that, you can make an impact where you feel, you can join where you feel you can make an impact. And that's really important to an organisation like me.
Great, thank you. And Abbi, over to you.
Yeah, I think we are, as a collective, we're very much about supporting our partners to work together and to really feed off each other. We recognise that some of the challenges are the geographical spread of our partners. They're all over the place, and they're all dealing with different local challenges and issues and services. And as Khudeja said, our partners have differing capacities to feed into different work streams. We recognise that, and we try to respond to that in the best way we can, and try to collaborate on our shared priorities and our shared strategic objectives, so that organisations can feed in ways that feel meaningful, but that don't feel that they're draining their capacity or resource. But really, what works well when you bring these different types of organisations together is there's these opportunities to collaborate and to share expertise and resources, to identify partnership working opportunities, to really consolidate the intelligence and the intel and the data and the evidence that we have to substantiate all of our strategic asks and our campaigning efforts and the policy changes that we're driving. And we want to share power and make space for each other. So women's organisations are always sort of fighting to be heard, fighting to be valued. And a coalition like ours can help to make space and platform the work that our partners are doing collectively and independently. We can really advocate for the value of that lived and learned experience that's so inherent and represented through women's organisations. And we can share a vision and a goal that's incredibly motivating when there are so many challenges for women's organisations and specialist services, where we can, in silo, feel really demotivated and demoralised by the landscapes that we're trying to navigate. But as a group, collectively, the shared vision and enthusiasm and commitment of our partners can be a driving force in itself. And it really helps us to stay centred and present in the space that we're operating in, to try to help our organisations battle on. And it shouldn't be a battle, but unfortunately for women's specialist organisations it oftentimes is. So an alliance and a coalition work and partnership working and solidarity and conferences like this that bring so many wonderful organisations and thinkers together, this is what we need. We need to affirm our position, our collective efforts, and move forward.
Great, Abby, thank you. And really positive as well, and really nice. And it's great that we are actually doing that and we're bringing all of these organisations together. Just one final question for you, Rebecca. We've obviously heard so much from each of the panelists on a range of different topics, but what message would you like women and girls organisations to take away from this discussion?
Thank you for that question, and it's a lovely one. And I think I really want all women's and girls organisations, whatever their size, to know that the work that you do is vital and that it matters, that Rosa is absolutely on your side and championing you. And we're here to fund you, and we're here to very much encourage others to do the same. And we do that, and we do this work because we know that every single progress in women and girls' lives, every single advancement in our rights has been won by women organising and mobilising. And that's what the women and girls sector does. There is not a single right that we have won in the last 250 years in this country that has not been fought for, won, and then held on to by women and girls organising together. And I think now, at this moment where we've got this funding crisis against a backdrop of rising misogyny and a real fundamental threat to some of our key rights, the women and girls sector is needed now more than ever. And I really hope that today and this session has helped you to know that whatever size of organisation you are contributing that vital change for women and girls.